Welcome to everybody for today's session, Coronavirus Mythbusters, the Cardiac Rehab Edition. So today we are going to discuss some hot topics about coronavirus that has been around in the media, a lot of research about this. So we have some questions that we can answer, and a lot of people is sending us their questions through email and to the program uh, staff. So we are going to try to solve some of these questions in this seminar. One of the first question is, could sun exposure and or hot weather could prevent COVID-19? This has been seen in in the media, in the news, that it could be related. What do we know about this? So we are actually recommending people to try to get a little bit of sun every day, from 10 to 30 minutes of midday sunlight. This is a good way and a natural way to get enough vitamin D. So just remember, if you're going to be exposing yourself to the sun, try to watch for the UV index, wear protective clothing, and also always use sunscreen. And try to avoid sun lamps and tanning beds that increase the risks for skin cancer. So in this image, the people that were having fun in the spring break in some beaches in Miami and other countries, they thought that they were immune for COVID-19, so they kept the party going on. But the fact is that coronavirus can be transmitted in all areas, regardless the climate, and even if it is hot weather. As we have seen, we can find it everywhere, and it's not related to the weather at all. So the question that sun exposure or warm weather could prevent COVID-19 is false. And we have also these newspapers that were released a couple of weeks ago from these people that went to the beach to have fun in the spring break, and they got back home with COVID-19. So yes, just be careful. Okay, for the second question is, can alcohol consumption protect you against COVID-19? So I'm going to talk a little bit about wine. We have enough evidence to say that wine have some benefits for the cardiovascular system. And this is thanks to the phenols that are the flavonoids and the resveratrol. These flavonoids have proved benefit by reducing atherosclerosis, reducing thrombogenesis, and reducing the mortality in ischemic heart disease. And this will lead to a reduction in the cardiovascular risk. But we are talking moderate consumption of 1 to 2 glasses of wine every day, not more. Because if we see if this amount is going to be deleterious for our health. And the international and national recommendations about alcohol consumption tell us that men should not drink more than 2 drinks a day, and women not more than 1 drink a day. And we have to live at least 2 non-drinking days during the week. And if you don't drink alcohol, please do not start. There's a lot of evidence about the harmful effects of alcohol abuse. Some of them we know that is a causal factor in over 200 diseases and injury conditions. So this myth is false. Drinking alcohol does not protect you against COVID-19 and can be dangerous. Another one of the questions that we got last week is the relationship between garlic and the prevention of COVID-19 infection. So garlic is a natural substance that can have some benefits in our health, and this is thanks to the organosulfur compounds in the garlic. And part of these suggested effects that we know are being proven on laboratory only. These effects have not been proven in the general population, so we have to clarify that. And which effects are we talking about? So in this a study was published in 2015 in the Journal of Immunology the Mexican group told us a little bit of these effects on health as an anti-inflammatory and antioxidant substance, modulating the anti-allergic response, and also promoting the activation and synthesis of immunoglobulins and antibodies. And there are some suggested effects on the cardiovascular health, some as lowering the LDL molecules, reducing the platelet aggregation and adhesion that it will lead to a better platelet function, and also reducing the progression of atherosclerosis. So we are saying that this has been proven only in animal models and in laboratories. So in some way, we can say that yes, garlic can improve your immunity in some way, but it's not going to prevent you from COVID-19. So the myth is false. Eating garlic is not going to prevent from having COVID-19, but eating garlic can be a boost for your immune system. Getting to more tricky questions, we have if we can recover from COVID-19, or if I recover from COVID-19, can I get reinfected again? So first, I want to talk about if we can recover from COVID-19, and the evidence is yes. Most people who are infected will recover and eliminate the virus from their bodies. And most patients will have this recovery thank you for their own immunity from their own immune system. As we know, today in Canada, there were 25,000 cases confirmed of COVID-19, and up to today, we have 7,758 patients with recovery, with complete recovery. Then, if we are going to talk about recovery, we have to talk a little bit of the antibodies. In this study was presented a couple of weeks ago from the Chinese group, they test if that was actually true. So what we know is when we have the primary infection from COVID-19, our bodies start producing antibodies. That these antibodies are going to protect us for the future infections. They are going to bind up to this receptor where the virus acts and enters the cell. So this antibody is going to block the entry of the virus to our own body. But we are asking, when are we start developing these antibodies, and when they are going to protect us? So the evidence is not clear yet. There is a lot of studies going on regarding this topic, and we have to be very careful when we make an interpretation of them. But what we know now is that after the primary infection, if the levels of antibodies reach a point that you are not going to get infected again, you will be protected. But if after the infection, your body didn't produce enough amount of antibodies, there is a theoretical possibility that you can get reinfected again. But this is highly unlikely. Talking about these antibodies, our friends from U of T, the researchers are already working trying to this or even prevent it. So we will see that what these further studies are going to give us. Until then, we know that yes, you can recover from COVID-19. And if you recover, can you get infected again? In theory, it's false, but we know there's always an exception for the rule. And that can happen if your immune system didn't respond as well for the first infection. You might get infected again. And we can talk also that the virus, through the time, can change, and that can also lead to a similar infection that could not be the exact virus that we got in the first place. Now we're going to turn a little bit more the talk around the face masks. And one of the main questions is, should I use a face mask in public? As this little kitten, you can see, is wearing this beautiful mask, and he looks great on it, but it's not protecting the cat for the COVID-19. Okay, so our Chief Public Health Officer, Dr. Teresa Tam, told us last week that wearing non-medical masks is an additional measure that you can take to protect others around you. And there are some key points that we have to take into account. First, the potential benefit of this is if the mask is worn by a person with respiratory symptoms, with a symptomatic infection. Two, if the exposure to public spaces and physical distance is not possible. This is an example if you are going to a grocery store. And the prevention of the spread from asymptomatic and pre-asymptomatic individuals is unknown, but theoretical. That's why we don't know yet. And that's why we are going to recommend the use of cloth masks for the public when they cannot take the measures of physical distancing, or if they are having symptoms to avoid the spread of the disease. The international organizations have something to tell us about this. One, the World Health Organization is telling us that people that is in contact or is taking care of someone with suspected COVID-19 infection should wear a mask. Also, if you are symptomatic, you should wear a mask. But the most important point is that masks are only effective if are used in combination with frequent hand cleaning with soap and water or alcohol sanitizer. The CDC make a similar recommendation, but a little bit more broad. They said wearing cloth face coverings in public settings where other social distance measures are difficult to maintain. As I gave the example in a grocery store, supermarkets, pharmacies, but if you're at home, you don't need to wear a mask in that case. And if you decide to use a mask, the question is which kind of mask. So the international and national recommendations are for the general public to use homemade and cloth masks. Please avoid use surgical masks and N95 masks. This can lead to very critical consequence. If we have a shortage of masks needed to protect the frontline workers, that will be a huge problem. So please try to leave those masks for the healthcare workers only. And another key message, physical distance and high hygiene are more effective and important to prevent the transmission of COVID-19 than the use of masks, and that is a fact. So if you are going to wear a mask, you have to use it wisely. You have to try to be very careful because you can lose the benefit of wearing a mask if you don't use it properly. So we are going to give you 4 steps of how wear a mask. First of all, in the first step, you have to wash your hands with soap of water for at least 15 seconds or using hand sanitizer before putting your mask on. The second step is to secure the loops around your ears and or tie it behind your head without touching your face during the process. As you can see in the image, the mask has to cover from the nose to the below the mouth. If it is not covering the nose and the mouth, the mask is not giving us any benefit. Then step 4, you have to adjust the nose piece, and that is very important. Try to do it with just 2 fingers, adjust it, and do not touch the exterior part of the mask. After you place your mask in your face, you should not touch the exterior part. And this exterior part is contaminated and should be considered as contaminated. So you should not touch it. So I want to give 2 examples in this image. In the first one, we have a lady that she's using the mask in a right way, but she's coughing and she's touching the mask with her hand at the same time. So if we consider that the mask now is contaminated because she touched it, now her hand is also contaminated, and the other hand with the cell phone is also contaminated. So the mask is not going to be useful at all. In the second image, we have this pleasant gentleman who's wearing the mask below the nose. And with one hand, he's using gloves and he's touching his face. So the gloves are contaminated. Now his whole face is contaminated. So the mask, there's no reason to use a surgical mask in this case. Okay, we're going to talk another day about the gloves, that there is no recommendation about the using of gloves, and the virus can live on the gloves for about 8 hours. So the message is to clean your hands. You don't need gloves. So we are going to give some other examples of how not to wear a mask. So as we said before, if the mask is below the nose or is allowing the mouth to be exposed, there's no benefit from using the mask. Another example, wearing the mask under the neck is also a way of contaminating ourselves, because if we consider that the mask is contaminated and we are carrying the mask there, we are carrying a contaminated cloth in our body, and that can lead to deleterious effects. In the last image, we can see this lady that she's touching her mask, and there is also a lot of gaps between the skin and the mask that should be avoided. And the last advice in this, if you're wearing a mask, please don't allow other people to touch your mask because it's contaminated. So if your mask is just for you. So we have been talking about the contamination of the mask. So it's very important that we have to consider that the exterior part of the mask is always considered contaminated and should never be touched. And if you're using a homemade or a cloth mask, it has to be washed after every wear. And one advice, if you're getting into your home, you put your face mask that you made at home, you're getting back to your home. So please remove your mask when you are entering your home. Put the mask in a plastic bag and then put it in the wash machine and wash it. Because if you just leave it everywhere, it can be a source of contamination for your home and for your family as well. Also, it's very important to take into consideration how we have to dispose the masks and how we are going to take the mask off. So the step one is, when you are going to remove your mask, wash your hands and do not touch the frontal part of the mask. Step two, remove the elastic loops or untie the strings behind your head without touching the mask. Stage three, you have to hold the loops or string and place the mask in a garbage bin with a lid if it is a disposable mask, or in a plastic bag if it is a homemade mask. And wash your hands at the end with soap and water for at least 15 seconds once you discarded your mask. And please do not throw the mask to the street. Do not contaminate the streets with the face masks. That's the worst thing we can do, because this is a source of infection and we can spread the virus by using the mask and not disposing the mask in a proper way. So what about other type of masks? So as we have seen, even in the street, in the supermarkets, a lot of people is trying to find out other ways to protect themselves, but we have to be careful to not contaminate us by trying to give us a benefit with this. Like in these examples that we have people wearing plastic cans or plastic recipients, they're going to be contaminated. And after that, how are we going to be disposing? Are we touching this? How are we going to take this out? Also, if you are wearing an orange, maybe you're not going to be able to breathe well. So try to avoid using other devices to protect yourself that are not considered adequate. So we have some key messages for you today. One is that if you're wearing a mask, this is going to help prevent the spread of COVID-19, but it also can become a source of infection if it is not worn or discarded properly. If you're wearing a mask, you should clean your hands frequently with water and soap, and you should not and never touch your face. That's the key message. If your hands are contaminated, you can do a lot of things outside, but before anything, you have to wash your hands. And do not use a face mask meant for healthcare workers. And this is difficult to achieve, but there are shortages of these masks, and we need our healthcare workers to be healthy, and they need this equipment to keep delivering the proper attention for all the population. And the last key message is the use of masks is not a substitute for social distancing. So if you're using the mask, it's for the reason that we spoke, not because you can hang out with your friends and family, not because you are wearing a mask. That is not going to work. So just be aware of that. And please stay connected for the next edition of Mythbusters Cardiac Edition Part 2. Please send us your questions, your concerns, or any other thing that you think that it would be good to talk about in these sessions. And please stay connected, stay tuned for the next sessions. So if there are any questions online, please write us and we can talk about that. So we have a comment about immunizations there is a new article online about 110 South Koreans have tested positive for COVID-19 after being cured from the disease. So there is some possibilities why this is happening. So one of them, yes, is reinfection. It's plausible, yes. Reactivation of the virus can happen also, or it can be also a mistake of the test itself, or the test can be seeing the DNA, the remnant DNA of the virus, or from an active virus that is still in the body. So it's very difficult to make this assumption that someone can be reinfected, but we have to stay tuned for more information that is coming on and the new research that we will be searching for. The next question is, for how long do we wear a mask to keep its efficiency? So if you're wearing a mask, it should be replaced every time you use it. For example, if you're going to a supermarket with the mask that you made, you have to wash it after every use. Next question is, what will happen when spring allergy season starts with symptoms of sneezing, coughing, and runny eyes? I think this already started, and it's very difficult to make the difference. But if you know your own symptoms and you had runny nose and suddenly you start coughing more, so that is something is abnormal. Know yourself and know your symptoms, and there's information that you can call to the line, to the official webpage of and the government line that you can make this assessment. So try to get more information if you have doubts about your symptoms. I think that was the last question.
And Fernando, so first of all, thank you very much. It's Paul O speaking. I apologize. I tried to do the introduction from elsewhere, and it didn't seem like my audio was coming through, but we thank you very much for doing a very engaging and informative session. On the last question, since I am also one who suffers with spring allergies, I wonder if we might think about some other symptoms that might help us differentiate. And we know that, for instance, fever is one of the more common symptoms associated with infection, whereas that would be distinctly unusual for a spring allergy. But I do sympathize that when we feel that way with the upper airway congestion and red eyes and runny nose, that can be confusing. And that's going to be something that's going to come up very shortly. It'll probably emphasize all the more that we'll need to maintain that physical distancing over the next several weeks as those symptoms run through the population. And I'm sure your friends will thank you as well. If you're coughing and sneezing, that they'll want you to maintain your distance as well.
Yeah, and just last comment common for our patients. Also, coughing is one of the symptoms, but shortness of breath too. If you're having problems with your breathing, try to get in contact with your physician. Try to get an assessment too. So I have another question. Maybe we can just answer this. Can sexual intercourse between my wife and me cause a transfer of the virus? If you have the virus, the answer is yes. So, but if you're both of you will be infected. And another last question is, should someone who has had coronavirus quarantine for 14 days and begins to feel better have 2 negative tests before leaving quarantine? Yes. It's the recommendation. I know Paul can give us more insight in this question.
Yeah, so thank you. Thank you for the question. I mean, that would be the ideal scenario if one were in a situation where you could have your initial test that showed positivity of the viral particle. Then you would run the course of your infection, remain in quarantine, and then 14 days later have 2 more tests done that show that there is no more virus in effect. So that would be an ideal scenario if one had access to all of that testing, which I think is one of the issues that we're facing right now. I can tell you the recommendations from our kind of advisory bodies would be, this is what we would like to see happen for healthcare workers before they return back to work. That is, you've been picked up early with your symptoms, you've been tested, you've gone into a quarantine, and then you've had 2 negative tests with also resolution of all symptoms, including being free of fever for some period of time before returning to work. Now, for members of the public, you may not be able to have this experience, especially if your symptoms have been mild and you've been in the community, in which case there is recommendations from the CDC and other organizations that would say, if you have been at least 7 days without symptoms, without fever, then that's the time when you can resume kind of regular good practices around maintaining physical distance, washing your hands, being thoughtful about being out in public, only if absolutely necessary. So that question is nuanced, and it may depend on the situation that one is going into. For the healthcare worker, of course, the reason for the negative test confirmation is that you may be in a situation where you're going to need to be up close and personal with a patient who is ill or a fellow staff worker in some kind of situation. So you want to ensure the negativity of virus before moving on.
So I will appreciate Paul and all the people that are seeing us from home. Please send us your questions and we will try to answer them in the next sessions. And thank you very much. And we'll continue delivering this information that could be helpful for you. Thank you very much, Paul.
As always on a Wednesday, we will be offering up the nutrition series. And tomorrow's topic is very important for this day and age of how we can eat well on a budget. Thank you very much for your time and participation. Thank you again to Dr. Rivera for running this very informative webinar today. And we wish you all very good health. Thank you.